you know what? We probably need to lay you back a little bit, get you on your left side.
Just 31 weeks pregnant, Marla has to give birth today. If not, she could go into seizures, and her baby could die.
This patient has a history of chronic hypertension and was doing very well in her pregnancy. Over the last couple of weeks, her pressures were getting higher, but then she began spilling protein in her urine. This was a sign that she developed superimposed preeclampsia. This condition can be very dangerous both to the mother and to the baby.
Approximately 25% of pregnant women with pre-existing hypertension develop superimposed preeclampsia.
You are running a limited race here. The baby will stop growing. The baby's life expectancy may be restricted, and unexpectedly you can lose a baby.
What do you want me to say, Ma?
There's nothing more to do for Marla or her baby.
The doctor's in here right now. Let me find out what's going on, okay?
The only option is delivery.
Okay.
But the timing couldn't be worse.
Okay, Dad, it's Marla.
On the other side of this very hospital, Marla's 66-year-old father is in the final stages of his battle against colon cancer.
Are they saying he's gonna go? Okay. All right. Okay. Bye-bye. In a couple of hours, I'll have a baby, and my dad will not be here, and so I don't know. But as long as the baby's okay, I'm sure that's all he really cares about, so. I just was so sure he was going to be able to see him, but maybe he will. Who knows? Yeah, they said he's going to go pretty soon, like in a couple of minutes. So,
if you want to go over, we'll see about trying to get you over there.
I'll just get way too upset.
Okay.
Trust me, it's not. It would make her more upset.
Okay. That is an option, so.
Where's the baby? Where's the baby's at?
2-year-old Kelsey Lukovic is about to become a big sister.
How many babies are in there? How many babies? 2 babies.
Her mother, Tammy, was admitted early this morning. She is expecting twins, which occur in 1% of all live births.
Yeah, but
my membranes broke at 3:30, and it's almost 3:30 in the afternoon. So it's 12 hours, and you're at risk for infection, once your membranes break. So we don't want it to go too long without, getting the babies out.
Well, you're 4 to 5 centimeters dilated. I hate to give up now. He's made a huge change.
Babies are too comfortable up there, I guess. They just don't want to come out.
Once the water breaks, there's no barrier to protect the babies from bacteria that can travel up the birth canal.
If she will be infected, mom will be having a fever and baby will be tachycardic, and it's potential risk for both.
Tachycardia is a dangerous increase in the fetal heart rate. There's a risk to Tammy as well. Her first child, Kelsey, was born by C-section, which makes this 34-year-old mother's uterus weak and extremely vulnerable.
The worst case scenario is rupture of uterus. So the baby can die right away. The mom can bleed to death.
And then there's the position of these twins. Baby B is breech, or feet first.
After the first baby's out, a lot of room is now available for that second baby to turn. If you can't get the baby to turn around, an option is to go ahead and actually grab the feet and deliver that baby breech. She's completely dilated.
Finally. Finally.
The vaginal birth will take place in the OR, because if the baby doesn't turn or gets too stressed by the birth, Tammy will need an emergency C-section.
That first baby's getting down really low. So we'll go ahead and move him back to the OR. And so we'll be ready for anything.
At midnight, Carla Miller and her best friend Cynthia arrive at University of Cleveland Medical Center.
I'm going to have my baby today. Or tonight. Or no, in the morning, actually. So, and I'm a nervous wreck.
The last time Carla gave birth was 22 years ago.
I'm a total mess because I have back pain and I'm scared, and I was too young for the first time to be scared. Now I'm too old and I know everything that can happen. I almost feel sick to my stomach, mess.
Your birth date, ma'am?
9/8/66.
At 37,
Yes.
Carla is considered high risk for a number of reasons. First, she has gestational diabetes.
The longer that you go with gestational, the longer that you wait to give birth, more risk of stillborn.
Then, early in her pregnancy, Carla's doctor told her she might have cervical cancer and that she might have to terminate.
So for a week and a half, it was total torture. It was harder on me than finding out that I had gestational diabetes. Ow.
While the biopsy came back negative for cervical cancer, it came back positive for severe dysplasia, a precancerous condition.
During the pregnancy, I found out that the cells have split, so it's getting ready to go into the full cancer.
Once this baby is delivered, Carla will have to undergo a hysterectomy to prevent any cancer from developing and spreading. Then, more bad news.
When we first had the first amnio, they seen a redness in the baby's bowels, and sometimes that could be cystic fibrosis.
Carla and her husband got tested immediately for cystic fibrosis. Carla found out only she was a carrier.
They said that, the most that'll really happen with the baby is she'll be a carrier. If she marries a guy that's a carrier, then they'll probably have a child with cystic fibrosis.
Not long after, there was the numbing pain in her hand.
I couldn't feel my fingertips. They were all numb, and I was having shooting pain go down through my hands at night into my elbow. They said that was carpal tunnel that's caused by the pregnancy, so hopefully that'll go away 3 months after I deliver. That book that has what to expect when you're expecting, I've had everything that's in that book. Can't give me any more bad news, I'm ready, but I'm not ready. I'm just not ready.
So you know you're for induction tonight, so I'll put a Silverdillan in your vagina to help the cervix dilate and kind of getting more soft.
I was thinking more like 7 o'clock in the morning I'd be ready to be having this kid, but that's not going to happen.
We'll see.
But with this pregnancy, nothing has or will come easy.
I'm decided I don't want to do this.
So this is your 7th baby, huh?
Gwendolyn McCrary's 7th pregnancy is unlike any of her other ones.
So we're going to induce you today because we can get this abscess in your mouth here. Okay. And how long have you been having this pain? Since Tuesday, okay. Does it make it hard to talk a little bit? Yeah. See, it's all swollen there.
Now 38 weeks pregnant, Gwen is suffering from an extremely painful abscessed tooth.
What we're worried about is the abscess spreading and her becoming septic, which means the bacteria is in her bloodstream. And if you're pregnant, that poses a lot more risk than it does if you're not pregnant. So the baby can get infected. Any infection in the baby can cause a poor outcome at delivery. The baby can be less likely to handle labor. And we decided to induce her. And then we could treat the dental abscess more aggressively.
Contraction's getting stronger, huh? I'm going to push on your belly a little bit.
Gwen's discomfort has been intensified by an extremely swollen belly that may be a result of an increase in amniotic fluid. Unfortunately, there's nothing her doctors can do to release that pressure.
I definitely can't break your water yet. The head's way too high still.
Tammy Lukovic is in the OR, trying to give birth to her twins.
Okay, let's go. Let's go. One more like that.
You're almost there.
Okay.
One baby is head first. The other is feet first.
There you go. Heads out. Hold on. Let's get ready for the shoulders.
Doctors are hoping delivering baby A will cause baby B to flip over.
There you go, like that. Push like that, push like that, push like that. There we go, push again.
is a boy.
That's definitely a boy.
Let's see what baby is. Okay, Beth.
The ultrasound shows that baby B isn't flipping.
Okay. Hold on. It was going to be the quickest route to delivery by getting the feet out first rather than trying to manipulate and get a baby to come around.
Although doctors knew there would be some resistance in getting baby B out feet first, they weren't expecting this.
There down. Get you some fundal pressure.